There are some other tools which could be effectively used to prevent nighttime hyperventilation and actually overbreathing during the day too. One of those tools we call the awareness belt. I'm going to show it to you. Just a belt like this, and it's available on our website. The other belt which we use is a stronger one, the belt like this. Both belts help to maintain awareness regarding deep breathing, and also in certain cases they help to restrict the movement of the diaphragm. During the night, overbreathing is really strong, and some people feel that their stomachs move a lot during the night. To increase their awareness during the night, it's possible to use one of those belts. In this case, you put the belt on the area of your diaphragm underneath your ribs. I'm going to show it to you. Just like this. And the belt should be cut, of course, to match, to fit your size. And right now the belt is rather loose on me. You see, I could easily put my hand underneath it. So it doesn't really bother me at all. However, if I switch into deep breathing during the night, my stomach starts moving like this, and I will feel this belt right away. So those belts are very effective to make us aware of the moment when we switch to very deep breathing. And there are other types of belts which are used for children, but usually we share this knowledge during our individual course. I think that it's too dangerous to share this knowledge without seeing a person who needs help with their breathing. So certain things I could just mention here to introduce certain ideas to you. However, unfortunately, I cannot teach them without seeing a person. There is another way to use this belt, as I already mentioned, and also a wider one, and it's when we restrict the movement of the diaphragm, and by doing so a person's breathing becomes much shallower. Again, unfortunately, I don't feel comfortable teaching it without seeing a person. So I recommend you to make an appointment with a breathing specialist. You could do it online from really any place in the world, or you could check our directory of breathing specialists. It's on our website, and you might find a local specialist and start working in person. For now, you could just use the belt the way how I showed it to you, but please If you decide to use the belt during the night, don't use any sleeping pills. Using the belt and sleeping pills together, it's really not a good combination, and it could be rather dangerous. If you decide to use the belt during the night, I recommend you not to do it right away, but to start using the belt during the day first. There are quite a few benefits which the belt or its usage during the day creates. One of them that when you feel that, when you start overbreathing and when your stomach starts moving a lot, you will notice it right away, and you could correct this situation. Another benefit is that it will help you to maintain good posture. And I'm going to demonstrate it to you again. So here is the belt. Make it a little tighter. So this is the area underneath my ribs. Here's the belt. And right now my back is quite straight. So because of it, the belt is loose on me. But as soon as I bend over like this, the belt goes right into my skin and makes me feel rather uncomfortable. So the straight back is essential for good breathing. And a lot of people who spend a whole day sitting in an office in front of their computer have a tendency, of course, to be like that. It's very good for them to wear a belt, since it will help them and remind them about good posture. And when a person's back is straight, a stomach is naturally pulled in a little bit, and that slightly restricts the diaphragm, and as a result a person's breathing becomes again naturally reduced. So maintaining a good posture is a very good way to reduce your breathing naturally, and the belt is a useful tool for it. The belt is an effective tool, however it's not for everyone. Some people with major breathing difficulties have a very bad association with their breathing being restricted, and it kind of brings up some memories of suffocation attacks. So those people, when they put the belt on, might get frightened, because it will remind them about the time when they had very strong breathing difficulties. And therefore we recommend starting with the belt slowly and gently. Put it on for a few minutes and see how you feel. And if you feel okay, then next time you could put it for a longer period of time. But please be careful. And again, don't try to use the belt to restrict the movements of your diaphragm unless you have a chance to have a consultation with a breathing normalization specialist.